Tell us a little bit about concussions. You know, you're an expert in the field, really one of the foremost people on the planet about it. Give us some walkthrough from a couple of perspectives. I'm an athlete. I haven't been knocked out, but I've been hit a couple times, either in soccer or basketball or football. What are some of the symptoms that I'm experiencing in my body?
Sure. So a concussion is defined as a traumatically induced alteration in mental status that may or may not involve loss of consciousness. So what does that mean? Well, it means that there has to be some insult to the body. It doesn't even need to be to the head necessarily. We can be hit to the chest where the head sort of creates this whiplash-like motion. And the alteration in mental status means that it could be memory impairment, it can be concentration problems, it can be dizziness, blurred vision, balance problems, and in about 10% of the cases, it'll involve loss of consciousness. But the majority of concussions do not involve loss of consciousness. It's unfortunately a misunderstanding about concussion, and we really want to emphasize that to kids, that even if you haven't lost consciousness, you can have a concussion, and it's important to follow those signs and symptoms. And then even for several days after that injury, they may not be experiencing the headache, the blurred vision, the dizziness, the concentration problems, but they may be experiencing behavioral type problems, sleep disorders, sadness or irritability. And so some of those are real important factors to consider in.
So a kid then, or that has that impact, that might only last, 30 seconds, 60 seconds or so, at least the initial kind of impact of it. And so you can have a tendency sometimes to dismiss it. It was only a minute or two. I kind of got a little buzz and I had some stars and stuff, but it was only like a minute or two and I'm okay now. But are they okay?
Well, again, it's why it's so important to try to track their recovery for several days after that injury, because in many cases the signs and symptoms that I've mentioned, they may resolve within 3 or 4 hours, and they may wake up the next day thinking that they're fine, but there still could be some underlying pathology that's involved there. We know that in about 25 to 30% of these cases, they'll have what we call a delayed onset of symptoms. So they may be dazed a little at the time of the injury, and then for whatever reason, they resolve, and they don't reoccur until maybe they're back out at a practice 3 or 4 days later, and that getting their heart rate up and exerting themselves may in fact recreate the symptoms, and so we just can't assume that if they're without symptoms at 24 hours, 48 hours, that we're done, and that he can go back to play. So just real important to track them for several days. The importance here is that the coach can help that player identify the injury, that they recognize the signs and symptoms, and that they're properly referred, meaning that they get in front of the athletic trainer. If there's not an athletic trainer there, then they're referred on to a pediatrician, to the emergency room. Somebody that has training in the management of concussion needs to lay their hands on this kid.